Hello, 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 everyone. Happy Saturday. Knew it without asking because I thought about it first. Happy Saturday, everyone. I want to start by saying thank you for all the love that you showed me when I was feeling sad yesterday. I am much better today, had my moment, and now I'm back. So that's good. Hi, Jackie. I love you. I miss you. And so today I want to talk to you about communication with patients with Alzheimer's because it is drastically different than with a patient who is not living with Alzheimer's, right? Or with a loved one who's not living with Alzheimer's. And that is because one of the main symptoms of um, Alzheimer's disease is cognitive impairment, right? They don't think as well or aren't as quick to understand things. They have memory loss, and I'll talk about a number of these things. And so it makes life so much more difficult for them, right? It increases their frustration levels when they're unable to communicate clearly the ideas and thoughts that they have or feelings that they have, but they can't think of the correct words for it. When they can't properly express themselves, certainly in a manner that makes it easier for you to give them what they need, then that's when their levels of frustration are increased. So you want to have extreme patience with them during these times, and you also want to be very empathetic because of what they are going through. And two, we understand, or I understand for sure, that it is a challenging time for you as a caregiver when your loved one is unable to communicate clearly. Because if you don't know what they want, what they need, what they're trying to express, then you can't help them to get what they want. So it's challenging for you because it requires you to be patient when maybe you don't have as much patience, right? It requires you to try to figure this out when maybe you don't know what the signs and symptoms of things are, like what their tells are and triggers that they have that might, and what activities they're doing, what they're doing physically to try to indicate what it is that they want, right? So you not being able to understand them, it can cause frustration for you and can be challenging for you as the loved one as well. So, and in that, you may forget that the person that you are talking to or trying to communicate with has Alzheimer's disease and what exactly that means for them. So I want to talk about a few of those things here to give you a better understanding and also some ways or ways to reframe what it is that you're experiencing so that you can give them the patience and show the empathy that they need or help them through the process in a way that's less frustrating for both of you. So we talked about the fact that cognitive impairment is one of the main symptoms, and what this looks like when it comes to the Alzheimer's, the person you love who has Alzheimer's and that you're caring for, is it shows up as memory loss for them potentially. They can't remember you sometimes. They can't remember and stay on track with conversations, say. They are unable to remember the words, the proper words for things that they're trying to communicate with you. Right, so they're having language problems and being able to properly express themselves, using the wrong words for things that they are trying to say. Their behavior changes, right? They are a little bit more forthcoming, right? They have less of a filter because of these cognitive impairments when they're dealing with them. So it leads to sometimes emotional difficulties as well because they can get frustrated. They have the agitation that comes with not getting the care or attention that they're looking for, or being able to express themselves as well. They have reduced attention spans, and some of us all have reduced attention spans, but they tend to have reduced attention spans as well. So it's harder to communicate with them because they don't follow you throughout, right, the discussion all the time. So you want to be mindful of that as well. And then their nonverbal communication. And these are just some of the things, right? This is not a comprehensive list, but their nonverbal communication changes. And you want to be able to see that and make adjustments. as well, or at least recognize it and then know how to proceed with interacting with your loved one, right? So some of the things that you can do to help in those situations and to make communication easier for them: simplify your conversations and speak in shorter, simple sentences so that it makes it easier, possibly easier for them to follow instructions, to interact with you as well, and to be able to let you know what it is that they need, right? When you are giving instructions or having conversations that involve you asking them questions, I still am and was definitely with my mom guilty of this. I'll ask a question and it's like a 3 or 4 part question, and then I expect you to remember and address each part of it, right? So it's hard for anyone to follow a multi component question in the first place. So imagine that for someone who's suffering from cognitive impairment. So you want to make sure that when you're asking questions and engaging with your loved one who has dementia or Alzheimer's, that you are asking short questions that are easy to understand and follow. And if it is a multifaceted question, you want to ask the first part, get a decision or an answer before asking the second part, and try not to ask questions that are asking them or forcing them to make a decision, right? They want things to be as easy for themselves as possible. And I was very, very much so guilty of this. I didn't quite understand why my mom no longer had an opinion about certain things, right? And it was because of the disease, but it just fascinated me when she was asking me what she should wear and, well, how does this look, like things that she was just uber confident about prior to the disease. She wasn't, or what she wanted for dinner. I couldn't get her to give me an answer. She'd always tell me, oh, I eat anything. And if you knew my mom, you know, she didn't eat just anything, right? So her saying that was because she couldn't process that decision-making process at that time, which would be frustrating for me because I didn't want to have to make all of this decisions either. And I knew that she didn't eat the way that I eat, in which case I wanted her to tell me what she wanted so that I could make sure she'd have something that she would eat, right? So something like that you want to be mindful of in just giving simple instructions, not multi-component questions, and not questions or discussions that force them to have to make decisions because they're not sure any longer for the most part. And you want to speak clearly and slowly because they have that cognitive decline, right? And because of it, it may be harder for them to follow a conversation. So you want to speak slowly so that they can process things, maybe if they can, a little bit better. And you want to speak clearly because, right, one of the possible issues that they encounter is hearing issues. And certainly as they get older, they may have issues hearing, in which case, if they can't hear you, right, or if it sounds muddled, right, so you want to speak clearly enough for them so that they can possibly process what it is that you're saying to them. Maintaining eye contact with them, right, is important so that they know and feel like you are truly present and engaged with them instead of talking at them and not paying them any attention. You increasing your nonverbal communication with them to be more reassuring for them and kind of, if it's comfortable for them, by the way, including and incorporating touch in with your communications with them to indicate certain feelings that you're trying to portray to them is very helpful. Have my notes here. So, yep, using nonverbal cues as I was just speaking to. And then want to make sure that you try to do some of these things. My great friend, Miss Judy, sent me this meme in Facebook that was listing 10 ways to communicate better with people who have Alzheimer's. And so one was never argue. Now let's be clear, all of these are not possible for us at all times. I can tell you that right now. So what you're going to do is strive to maybe incorporate some of these suggestions into your communication with your loved one, right? You are not a failure if you're not able to do all of these things, or if at times you do the opposite of what's being suggested here. You are learning, you are human, and depending on where you are in this journey and the level of frustration, right? Because it's going to be hills and valleys that we're going through, right? In terms of how well we can maneuver this disease. And so give yourself the grace to maybe not be able to do all of these things all the time, but here's some things that you want to strive towards, right? So one is never argue. Because of the cognitive decline, they don't process what you're saying. They're not going to hear you. They may be confused about what they're saying, right? So how we can expect them to listen to reason is kind of silly, right? When you think about it. So never argue, instead agree with them, right? And I mean, clearly we're going to use discernment and not agree to like things that could be detrimental to them or hazardous to them and dangerous, right? But we don't always have to be right. And it's just as easy for us to just agree and get past that moment than it is for us to have to take a stand because of our past relationships, right? And or just because of who we are, and then prolong the issue, create arguments, right? So never argue, instead agree. And then you can move past that to something else. Next was never reason, instead divert, right? So you're not reasoning with them because they, in many instances, they can't process this discussion that you're having, or where they are is where they need to be, right? In their heads, where they are. And as such, you want to make sure you're meeting them there. So you're not going to try to reason with them to make them understand what may be factual and true. You're just going to divert the conversation if you can, or run with it, right? The discussion we had a little while ago about therapeutic lies, fibbing, therapeutic lies, right? I was trying to tone it down a little bit, but in essence, it's still not facts, right? You have to incorporate some of that into your interactions and communication with your loved one. So start to practice this. Never shame, instead distract. So there will be times when accidents happen, or when something that could be embarrassing, something that that your loved one has done something that could be embarrassing for them, that wasn't the right thing to do, or for any reason, right? You don't want to bring or shed a huge light on what didn't happen correctly. You don't want to shame them. You want to go ahead and maybe try some reassurance and distract them around what happens, and show that compassion and empathy for when accidents happen with them, because you don't want them to kind of fold it and crumble inside based on things that are no longer in their control, right? Your loved one is still there, and they're just trapped in their mind. So even if they can't process things, they can still feel things. So you want to make sure that you're careful with instances where their feelings are involved. Never lecture, instead reassure, right? My mom was very, very clear about what upset her. One of the things that upset her. And that is that she didn't like being treated as a child. She didn't like being told what to do, right? So when you need to get them to do things that they may not be willing to do at that moment, you want to make sure that you finesse them, right? And not try to steamroll over them, but figure out a way that's mutually acceptable for them and you to get to your end result, instead of trying to force them to do things the way that you want them done when you want them done, because that saves you a lot of headache, because they are very stubborn, or can be, right? So never lecture, instead reassure. Never say remember. One of the things that they're incapable of doing is remembering things at all times, right? So you want to make sure that you check your language when you're talking to them, and your goal may be to try to remind them that you said something, but the fact is that they probably can't remember it, in which case you don't want to frame it as if they forgot something, because again, that could make them feel like something is wrong with them, right? Or it may make them get a little bit more protective of themselves and kind of fight back when you're not trying to start a fight at all, right? So never say remember. Instead, reminisce with them about different things and just reframe how you're bringing up that topic. Never say, I told you, right? I already told you X, Y, and Z. We already talked about this. And this one is definitely a hard pill to swallow for us as caregivers, because one of the things that happens with people who have Alzheimer's or dementia is they lose their memory, in which case they don't remember that you just said the same thing 2 seconds ago. Or sometimes, right, for my mom, she would remember that I just told her that, but it would be after she asked the question again and I answered it. Even if I just answered it, she would like, I'm just so stupid, right? And which broke my heart, right? Or I just can't remember anything, right? We did just talk about this, right? So she would remember after the fact when I repeated to her the conversation or that piece of the conversation that we just had. But being careful not to say I told you X, Y, and Z, and really just being kind when you're speaking to them, because one of the things that you are going to experience is having to repeat yourself over and over and over again, right? And it could go for as long as 10 minutes on that one topic before it either sinks in or they're on to something else. And it gets frustrating for you, potentially. But you want to always think of them and how they're experiencing this before you succumb to that level of frustration. Never say you can't. When I talk about finessing, this is one of those things, right? When you are telling when you are charged with their safety and keeping them from doing things that may not work well for them or could cause them harm, but they insist on doing those things, not telling them that they can't is going to help, or telling them that they can't do something is going to make them kind of draw that line in that sand and then try to do that thing even more in many instances. So again, it's not, you can't, instead talk about what they can do, right? It's kind of redirecting again as much as you can, because you can't reason with them, right? Saying it's dangerous outside, saying how dark it is outside, how it's nighttime. I used to go, because I wasn't really savvy with this at times, I used to go open the door and show my mom just how dark it was outside. Like, where are you going? It's pitch black out here. So where are you going to go when you're trying to leave the house at midnight, right? But talk about what they can do. Maybe say that we'll go out tomorrow or something like that to kind of appease them, but at the same time get what you need, which is keeping them safe. Never demand. Ask them things. And again, it's just, you don't want to, even though technically you are in a position of power over this person, now that you're caring for them and responsible for their well-being, you don't want to behave as if you are. You don't want to make them feel as if they've lost control over their own lives, right? And now they have to listen to you, but you're the child and they're the mama. So you want to ask them the questions in a way that you can get to your end result instead of demanding that they do X, Y, and Z. Don't be condescending. You don't want to do that to anyone, yet alone to your loved one that you're caring for. And engage with them instead. Maybe figure out a way to get them to the end result or in that conversation, or to understand what the next logical piece of that conversation is, or the next step after something, right? Instead of being condescending towards them. And never force, but reinforce with them is the last of them. So that's a lot, I know. And again, it's a lot to try to process and try to make happen. But you want to work towards doing whatever it is that you can do as the person who does not have Alzheimer's or the cognitive impairment, at least not to that degree, right? And the level of cognitive impairment will differ depending on which stage of the disease that they are in. So it's important too, right? Because someone in early stages in the early stages of dementia or Alzheimer's are more capable or is more capable of making decisions and doing certain things. So you don't want to just blanketly take over their lives just because Alzheimer's has been introduced, right? So you want to treat them accordingly, allow them to do as much as they can, for however long as they can, before you actually start to kind of inject yourself into their lives even more than they may need. And one of the other things regarding communication too, especially when it's hard for them to comprehend a conversation or to stay on track within a conversation and not get distracted, is to create a calm environment around them. With as few distractions as possible, maybe a quieter environment for them so that when you are communicating with them, they don't have 10 things going on in the background that is vying for their attention, and they can better focus on what it is that you're talking to them about, right? So that is our discussion on communicating with your loved one who has Alzheimer's or dementia. Please do let me know if you have any tips or tricks that you use to better communicate with your loved one. What are some of the issues that you've seen that they've had? Even if it's the ones that I mentioned that others can learn from. So please do comment on whichever platform that you are on to help us continue this conversation. And I will talk to you all tomorrow. Right.